Okay, so good evening to everyone, and it is thank you everyone for joining because a lot of people joins late. That is the result. We started a little bit late, 10 minutes late. Okay, so my name is Dr. Joy. I'm associate professor of nutrition and dietetics. Basically, my first I am a medical doctor, and after becoming a doctor, I went to I did my PhD in MD, PhD. I went to USA. I did my research work in nutrition and medical dietetics. As I saw that a lot of people need help, and not only medication. Medication every time you cannot take. More medication you take, more complication you get it. Okay, I'll give you many examples that a lot of diseases can be treated naturally also. Okay, so I see that Jhansi has joined. Jhansi, just I saw you have joined just now. Just send me a message on my WhatsApp and write it down that you have joined. Okay, Jhansi, are you with me? Can you hear me now? Okay, so whoever has joined, I hope everybody has sent me a message on my WhatsApp. Yes, if not, please do send me a message on my WhatsApp. Like Jhansi has joined now. Jhansi, are you awake? Just send me a message on my WhatsApp and write I have joined. Okay. Okay, 1 second. Okay. So as I told you that the nutrition and dietetics is high demand nowadays. And after finishing my PhD in nutrition and dietetics, I'm doing my research work in cancer diets because a lot of people in India have cancer, and cancer can be treated naturally also because cancer cells are feeding on glucose. What is glucose? You are getting from all carbs. So if you want to create a cancer diet, and cancer cells doesn't have also mitochondria. What is mitochondria? I hope everybody knows. If you don't know, you have to open your class 6 biology. It's an energy house, and cancer cell grows only by feeding on glucose. So that is the reason it is also connected to nutrition and dietetics also in many cases. So I'm doing the presentation now. So as I told you that this is a interactive session. So I would be advising everyone to take part. Don't get shy and don't sleep. Be awake, and a lot of interesting things you will learn. And if you are a dietitian also, it will be you will be opening your eyes if you see a lot of new things and new information as far as the US standards of nutrition and dietetics. And also, if you have to if you want to ask me any question, you can stop me. It's not interesting if I will be speaking. I will be speaking only. It will be not interesting. It will be both ways. You have to also speak. I will also speak. So it becomes a interactive sessions. Okay, and both of you can benefit. And at the same time, it is good that you can. If I ask something, you can also answer, because if you are eligible enough, you can also join my team also. Okay, and work and earn money. Why not? Okay, so everybody can see that presentation. Yes. So now we are having two courses we are starting. That is basic course and advanced clinical nutrition course. Basic course is for beginners. For example, a lot of people I see from today, from somebody a bank from bank or BA, or let's say BA IT, or somebody engineer, because 60 to 70% of my students are also from non-science background, because the need of nutrition and dietetics is very high. A lot of people need help, and a lot of non-science people are also joining. So it's not that you cannot learn. You can learn definitely with the basic course. After finishing basic course, you can learn the advanced course. Okay, what is the difference between basic and advanced? I will explain. And first of all, let me explain the need. What is the demand of nutritionists and dietitian in India is very high. As you saw that in India is one of the becoming obesity nation. Unfortunately, we are having more than around approximately 800 million people are overweight. It is almost 70 to 75, 80% population. It's a very huge number, 85 crores like this. And it is increasing. Okay. And the main reason is the food habits. We are the largest consumers of carbohydrate in the world. We are exceeding China also. And that is one of the reasons we are one of the #1 country in the world in terms of diabetes, which is also, unfortunately, it is not a things to be get proud of. Okay. You are exceeding also China. So that is the thing. And the knowledge what you will be learning will be the it will be a different high level of knowledge, and you will not find in Google uncle will not teach you, YouTube auntie will not teach you. Even a lot of dietitians, doctors, MSc, PhD professors also come to study, because learning is not a, it doesn't stop actually. Learning is an unending process. Okay. So a lot of new things are coming. Okay. For example, if you see that you have a lot of people who are, I think Nivedita as a dietitian, Renuka as a dietitian, I think, yes, you have learned doing the calorie counting, calorie deficit diet plan. It is 1980s. Nowadays, it is a little bit outdated. It may work, but the weight will come back. Because if you imagine a person taking, if you're calorie deficit diet, you are giving, okay, one chapati and one a little bit of sabji or vegetable you are giving. Well, how many calories? One, two bread, hardly around 300 calories you are giving. 3 times in a day, let's say 900 calorie, 1000 calorie you are giving. But where is vitamin? Where is minerals? Where is protein? Where is fatty acid? Nothing is there. So there will be hormonal imbalance. The weight is coming down, after some time stuck, and weight will come back. So in this way, you learn how to make a weight loss or weight gain permanent. Okay. So we will discuss all these things. And for example, for a basic course, is, as I told you, it is for beginners. It is mostly for those who wants to learn about their own health, or you, or for somebody you want to help, or you can earn also if you get diet plan, weight loss and weight gain. So here you are learning some new terms like glycemic index, insulin resistance. Insulin resistance, even a lot of dietitians and doctors have confusions. We'll clear today. Insulin index, there is another term which is a new term. I am sure a lot of dietitians is also have confusion here. Glycemic index, I hope you know it. In here you are learning mostly there are value of the food. What food you have to eat, what food you have to eat more, what food is you have to eat less. In this way you learn what is the quantity of food for age, height and weight, what is the balanced nutrition for weight loss and weight gain. For example, sometimes weight is stuck, weight is coming down and gets stuck, or weight is going up and gets stuck. Then you have to know how to overcome these plateau stages. And also you'll be learning some special diet plans also here as a bonus, like, you know, some detox diet. Somebody will tell you, you know, I want to lose weight, 8 kg in a month, 10 kg in a month. I have a marriage. I'm going for a, some celebrity will come. I've got many celebrities. They come and say, you know, I want to lose around 10 kg in a month. There are certain diets are there. You can do it. Certain techniques are there, but you don't do it in every day. Generally, 5 kg weight loss is a good weight loss. 4 5 kg normal weight loss. But sometimes some emergency happens, then people want to lose more. It is also possible, but that also we learn. There are certain intermittent fastings are there, which is almost people are doing in a wrong way. After some time, you get also some complications. The weight is stuck, or people are becoming very weak. So you will also learn about it. Keto diet is very popular in USA, but in India it doesn't work, because Indian people cannot take so much of protein. I have got many clients, like many doctors who have done keto diet. After that, their cholesterol increased, or the weight is stuck. So I have prepared another diet, which is my own innovation, a smart keto diet, which is made for Indian people. In USA, people can eat a lot of meat and, you know, salad. It is good, but in India, it doesn't work. So in this way, the basic course will be giving you about the basic nutrition and dietetics knowledge, weight loss, weight gain. The high level course is advanced clinical nutrition course, where you are learning about the clinical aspects. Okay, clinical aspects means you're learning about the when there are metabolic syndromes are there. Most of your client will not only come with weight loss and weight gain. Okay, they will come with both weight loss, and also they will tell you, okay, I have got PCOD. Somebody will tell you I have got weight loss, but I have got also cholesterol. Somebody will tell you I have got PCOD plus cholesterol. Okay, somebody will tell you that I have got also uric acid. So it's a complex weight loss and complications. People are coming. Okay, so in this program, you are learning about mostly the complicated situations, like, you know, in one of the every 3 women in India will have some hormonal imbalance cases, like PCOS, PCOD, okay, acne, facial hair, or let's say infertility, irregular periods. What gynecologists give generally? Hormonal tablets or birth control pill tablets, which are artificially synthesized hormones. Okay, and that is the reason. In this case, what will happen? You will be getting hormonal pills have got a lot of side effects. For example, if you take hormonal pills for a long time, weight will increase. It can create the same hormonal imbalance and also infertility. And it can create fibroid also in some cases. What is fibroid? It's a kind of a tumor in your uterus. It can be small, it can be big. And also issue with the pituitary gland. So it is not advisable to take every time medication. And PCOS, PCOD, all my students are reversing naturally. How? You will learn today after 10 minutes. Also about thyroid. People take a lot of medication in thyroid, but it doesn't work. Dose increases. Why? You can do reverse thyroid naturally. All my students are reversing. Fatty liver is very common. 65% to 70% population of fatty liver. And a lot of people doesn't know. Belly fat, diabetes. Why diabetes? You will see that diabetes only medication is not enough. If the diet is not there, then your doses will increase and complication can happen. Uric acid, high blood pressure, gastritis. IBS is a celiac disease. When the gluten level, gluten intake is very high, body has autoimmune reactions. Psoriasis, then also arthritis, menopause, cancer diets. All these things you will learn in the pregnancy diet plan. You will learn in the advanced clinical nutrition course. You cannot use calorie cutting diet in thyroid. If we eat less food, what will happen? The thyroid will be worsened because hormones are made up of what we'll discuss today. Okay. So in this way, you will learn all this in the advanced course. But if you are a BA or BCom or you are a bank person, you can start with basic, then you can learn advanced also. But if you jump in advanced, it will be difficult. You will not be able to swim. It will be difficult. So you have to learn swimming in a small pool. Then you have to go for you have to swim in the ocean, for example. So why the beauty of the course is this? All my students are having hands-on experience. Okay, hands-on experience means you are not only getting theory. Theory is fine. You can learn by heart or you can just memorize and pass exam. But what about practicals? Practicals means what? Hands-on experience. You will be dealing with clients. That is the reason a lot of even MSc, after doing MSc also, internship also, people come to have a hands-on experience. After doing MSc nutrition or BSc nutrition, after doctors are also coming, PhD professors are also coming because here you are able to do hands-on experience. And on theory part is different than your practical part. In practical part, you see there are a lot of things which are not written in the books. You have to gain from the experience. Okay. For example, I will show you my students like one of the students like Jigyasa. She also was able to, after 1 month, she was able to reverse diabetes. One of the case study, you can see this woman was having 150 and HbA1c is the glycosylated hemoglobin. Everybody knows glycosylated hemoglobin. I hope so. Some Dr. Nivedita knows, I think, because it's a medical term, but dietitian also know. It's a, we'll discuss what is glycosylated hemoglobin if you don't know. It was around 10. So when the, after taking the diet properly, without medication, it came down to 93. Normal fasting sugar level is up to 100 is normal, if you don't know. So in this way, you will also learn how to reverse diabetes. Okay, why? Because look, in India, diabetes is increasing 120%. It is one of the most diabetic country in the world, and it is more increasing. And only taking medication will not help you. People are taking what? Metformin. It's a medication in diabetes, doctors know, and maybe 2 gram, that is 2000 milligram morning, 1000 evening, 1000. Still, the sugar level is high, 300, or let's say it is high, HbA1c is around 15. Okay, and also taking insulin, still glucagon still high, because only taking medication is not the remedy of diabetes. Because as per the research, if you take medicines of diabetic every day and you don't care of your diet, and medicines doses will increase, and all medicines have got some side effects, less side effects, more side effects. You can see the diabetic medication, if you take, you can get fatty liver and also cancer in some cases, like liver cancer, like pancreatic cancer. Okay, so there is a reason only taking diet plan and becoming happy is not good. Only taking medication and becoming happy is not good. You can take diet plan also, because you see in diabetes, as far as the WHO guideline, what is written here? That have complications like heart, cardiovascular disease, kidney failure. Most of the diabetic people dies of the kidney failure, and blindness, strokes, limb amputation. Why it happens? Even though you are taking metformin, even though you are taking insulin, it will happen. So why? Because what happens there is a glycosylated hemoglobin, HbA1c. Anybody knows what is HbA1c? Dr. Nivedita, you want to tell what is the meaning of HbA1c? Don't get shy, doctor. If you know, just tell Anmol Joy, what is the meaning of HbA1c? No one. I think people are so shy. Once difficult to answer also. Harmeet, do you know what is HbA1c? No? Mansa? HbA1c?
Yes,
Yeah,
average group,
tell me.
average
What is it?
sugar of 3 months,
Yeah, but what is
HbA1c.
sugar? It is sugar, not only sugar, doctor. It is glycolated. Glycylation means what?
Isolated hemoglobin,
Means
right?
what happens? The sugar molecule will be attached with what? With protein. That is, hemoglobin is a protein. And it will become a glycolated, it will become very thicky substance. And it is making the blood very dense. And slowly, it will start scratching the arteries. Inflammation. What is inflammation? Inflammation means any injury. I hope you know about it. It will scratch the arteries, and after some time, cholesterol deposit starts. So sugar is the most dangerous than the cholesterol first, remember. And there, slowly, the arteries may become blockage can happen. No blood will go. That is what happening here. You can see diabetic heart disease. Almost 80-90% people will have this. Okay. That is one of the reason of the inflammation. Take one ball, let's say you take one frying pan and you scratch it with a, let's say, steel spoon, and after that you cook with butter, you will see fat deposits are there. Same thing. Scratching of the arteries takes place with this HbA1c and fat deposit starts. And after some time, cardiovascular diseases happens, heart attacks. Nephropathy. What is nephropathy? Because when the sugar is high, it is going away from the body. And what happens? Kidney has to restore more water from your body's intercellular and to work more. And what happens is sugar molecule can destroy the filters and kidney damage can happen. And also HbA1c, glycolated hemoglobin, can destroy the kidney. So it is mostly kidney failure happens in diabetes. Okay, it is called nephropathy. And how to overcome kidney failure? You have to either you take this dialysis. Hemodialysis costs around 7,000, 8,000, 10,000 per day. Okay, so in a month, around every day, in a week, 3 times in a week, people have to do it, and it is time taking, and also 7 hours, 4 to 7 hours, and it is expensive. 1 lakh, 1.5 lakh per month, and a kidney transplant is also expensive, around 40 lakhs, 50 lakhs, like that, and very difficult to do it. And also sometimes numbness in the leg called neuropathy, because this the circulation of the blood is affected and nerve cells dies. If you take a pin and also hit your this leg, you will not feel anything. And also retinopathy means this eye in the retina. Retina is a center in your eye, in your eye, where your optic nerve is attached. You see, blindness can give it because the whole retina can be affected with a glycolated hemoglobin. And after some time, whole body is affected. It is silent killer. Okay, and after that, what happens? This amputation. Why? Because sugary environment can increase the bacterial growth and less circulation happens. Okay, and after that, what will happen? The bacterial attack will happen and legs are becoming gangrena. It's amputation. These are all complications. And high BP can happen because high level of sugar can increase the insulin's retention. Insulin level will go high and sodium retention. Sugar is much dangerous than salt also. So you can understand 75% of the disease in the world is happening due to over intake of carbs. So all these situations can be overcome if the client would have, the patient should have taken a diet. There would have been less cholesterol. There would have been kidney function will be better, and people can increase their longevity. So, and diabetes type 2 can be reversed also. I will show you many examples. And type 2 is maximum. 80-90% people are having type 2. Around 8% people have type 1. Type 1 is a juvenile diabetes. Then you can maintain the lifestyle for longer longevity. Okay. So in this way, you can see how the diet is important. Only medication will not help you in many diseases. With diet, you will be able to live longer. With your client will live longer, and complication will be much less. Okay. So as I told you that a lot of new things you will learn in nutrition and dietetics, and I focus that my students are getting myself or my teachers. This group I am taking, so you'll be in my, I'll be the mentor of this group. So you'll be learning a lot of new things. Okay, and every time you can see that you'll be ahead of your own, fellow dietitians, because you learn the latest in nutrition and dietetics. Okay, I think Anirudh has joined some now. Anirudh Prakash, can you hear me now? So I will,
Yeah, I can hear you. I can hear you.
request to Anirudh, just send me a message on my WhatsApp that here Anirudh has joined. Okay. Did you send me a message on my WhatsApp? Anirudh, I think you are a fitness trainer. Yes. Okay. So just notify me on my WhatsApp that you have joined. Okay. We have just started. We have missed something, but I have the recording. I can send you afterwards. Okay. Thank you. So as I told you, in nutrition and dietetics, you will learn a lot of new things. So one of the new things, I hope a lot of people know about it, like, glycemic index, but still there are some confusions are there. Okay, so in-depth knowledge and clarity is very important if you want to become a successful dietitian or a nutritionist. So what is the meaning of a glycemic index? I hope most of the people have heard about it, especially dietitians or non-dietitian also. Why not? You heard of it. Somebody joining now. Very nice. Okay. Rohit is joining now. Okay. Okay. So that is the reason you have to know that what is the meaning of glycemic index? Anybody knows about it? Dr. Nivedita, you know glycemic index? It's a very easy question. Anurod, you know. Dr. Vandana, you have any idea what is the meaning of glycemic index? I hope you have heard, 100% you have heard in your
Is the relative ability of a carbohydrate food to increase the level of glucose?
Yeah, it is almost near to it. Okay. Dr. Nivedita, you are a dietitian. You have any answer? No? Okay, it is something related to
the foods containing carbohydrate, the level of carbohydrate.
It is containing carbohydrate.
The level of carbohydrates.
Okay, I understand. So
Carbohydrates.
Carbohydrate from which food? That is very important. Okay, so the glycemic index is a metric actually. I think Rohit has joined now. Two people have joined. One is Rohit, another I am not able to identify. So whoever has joined, send me a message on my WhatsApp there. You have joined. Okay, just write me, notify me. Okay.
Increase the level of glucose by eating carbohydrate food in the blood.
Yeah. So it is told by Dr. Vandana. Yes. Okay. So
Yes.
yeah. So what happens? So let us take an example, because a lot of people doesn't understand what is glucose. Glucose is what is glucose? It's a sugar. Okay. Sugar means not the sugar what to add in your tea, not that tea sugar. There are many types of sugars are there. Almost 50 types of sugars are there. Number one sugar, what is you are getting from your bread? Okay, from bread, what you are getting? You are getting glucose. From fruits, what you are getting? Fructose. From milk, a lot of people think, I drink milk every day, I don't add any sugar. Without adding sugar also, you are getting inbuilt
Glucose.
Not glucose, lactose. Lactose. Already there in the milk, lactose is there already. Okay. So what? So imagine that one bowl of rice, let's say 150 gram is there. Normally people will eat in the morning, or poha, or one bowl of dosa or idli, khichdi. One bowl of rice, 150 grams of white rice. How many grams of glucose is there? Anybody can imagine and tell? One bowl, 150 grams. How many grams of glucose is there? Mrunal, you know? Mrunal Nivane. Okay. Manasa Harmat. Manasa, do you know how many grams of glucose is there? Or doctor, Dr. Vandana? What do you think? How many grams of glucose is there in one bowl? 150 grams of Dr. Manasa Harmat, you know? Any idea?
Approx 90 to 100.
You're telling 90 to 100. Okay. So you are very near to it, but generally in 150 grams, you will be almost get around 100 grams of glucose, you will get it. Okay. Depend on what kind of rice you are taking. If it is a brown rice, it will be a little bit less, maybe 60. But if it is a pure white rice, it will be around 100 grams also. It depends on the different food have different glycemic index. But both rices, brown rice or white rice, both are having high glycemic index. Okay, wheat also same. So let's say you are taking 100 grams of glucose you got in your body. Okay, but this rice you take to your mouth, it is entering to your stomach, then it will enter to your intestine. After intestine, where it will go? What is the next destination? From intestine of a body, intestine everybody knows, okay? Stomach, below the stomach, intestine is there. Where it will go? Any idea?
Sir, glycemic blood.
Why? What glycometer you were telling? I am asking something
No,
else.
I'm saying it will go in the blood.
It will go in the blood. Yes, correct. It will go in the blood because the intestine is connected with your this you have studied in school also. The intestine is connected with villi, and villi has got projections. Your absorption of it will come to your blood here, like here you can see. It is a intestine here. Glucose will come. Glucose or any other food will absorb in your blood. After that, what will happen? Sugar level increase in the blood, but you don't become diabetic. Why? There is something happening after that immediately. What is something will happen? Do you know, Anirudh? Very easy question.
Yeah.
What will happen?
The cells will have to observe that glucose level.
But you are missing one
Insulin
thing. Who told insulin? Yeah, it's a question of class standard. It's not even a university standard. Insulin will come. It's a very easy question. What is insulin? Doctor.
Insulin is the gateway for entering the cells. Glucose to enter in the
You are
cells.
not answering properly. What is insulin?
sir, fat deposition.
No, insulin is a hormone.
It's a hormone.
Insulin is an hormone, sir.
Yeah. Who told hormone is correct? Okay.
I told.
Hormone is correct. Yeah, hormone is correct. Insulin is a hormone. But what is the meaning of a hormone then? What is this? Dr. Vandana, you know what is the meaning of a hormone? Can you describe a hormone? What is this? Is it a substance or a powder?
Hormone is a chemical released by body to regulate some of the important factors.
What chemical? What is inside hormone? Where it is released? How many hormones are there?
Insulin is released in pancreas.
Okay, so hormones is made up of what? Any idea, Dr. or Munal? What is made up of what? Hormones are made up of? Rupinder, you know?
Basically, it's a protein.
Who told protein it is? Dr. Vinay told. Yes. Okay. Vandana, sorry. Like the Vandana. Look, the thing is to understand hormone in a simple manner, I want to tell in a simple way that everybody understand. Hormones are communications in our body. Like you communicate through WhatsApp, you send messages to WhatsApp, or you send emails, okay, to your friend, to your work. Our body also communicates messages. So communication mechanism is maintained. It's a hormones. We don't have a WhatsApp inside your body. It's a higher level of communication. Okay, so hormone give instructions to any functions, weight loss, weight gain, your moods, your periods, everything is controlled by hormones. Okay, so the question is, what hormones are made up of? I think Dr. Vandana told proteins.
So hormone is a chemical messenger for the body.
Or a chemical messenger, but what hormones are made up of? Number one, it will contain some fatty acids, like amino acids also, proteins. It will contain vitamins, is important in the synthesis of the hormone. Without vitamin, you cannot synthesize. Zinc, selenium, some micronutrients. So imagine you are learning a great calorie deficit diet plan in MSc. Okay, after getting a diet plan, yeah, please don't. There is a sound coming. Just mute yourself. If you want to talk, just unmute it. Okay. So let's say calorie deficit diet you are making. You are looking at calories. A small amount of rice and small amount of, let's say, dal you are taking, or lentil you are taking, and a calorie is, let's say, 300 calories there. Lunchtime again rice and one roti, let's say 400 calories. Night time again one rice and vegetable. In a day 1000 calories you are taking. Okay, it's a very nice calorie cutting diet plan. But in reality, this diet plan will work initially. After some time, it will not work. Where is vitamin? Where is protein? Where is fatty acids? Where is micronutrients? Where are hormones? Hormones are not balanced. So if you want to become a dietitian with a reputation, the hormonal balance has to be there. Only calorie cutting diet plan doesn't work. That is a reason is very important. You will learn how to create hormonal balanced diet plan. Okay, a lot of people get afraid. Hormones is so dangerous. Hormones is not dangerous. It's our friend. You know how many hormones are there in our body? Dr. Rupender, you know, or Dr. Vandana, how many hormones are there? 1, 2, 3, 4, 5, 6, 7, 8. Mehak, you know how many hormones are there? Give me a number which comes in your mind first. Nivedita, anyone want to guess?
Over about 50 or
50,
more than 50.
More than 50.
Too many hormones are there
50,
in the body.
sir. Over 50 hormones are there in
Over 50
human body.
Over 50.
hormones. Somebody will
50.
tell 52 hormones. Mehak, how much you will tell? I will tell you there are more than 800 hormones are there. It has been opened as of now. There will be more. Okay. And that is the reason hormonal balance is very important. Now the question is, I think Anirudh Loke, here insulin will come. Okay, insulin will come and it will grab the glucose from the blood, because otherwise you become diabetic. Okay, so insulin comes from pancreas. Okay, it's a carrier hormone. It will grab the glucose and take it away from the blood. From blood, where it will go? What is the next destination? It will go to your leg, or it will go to your nail, or it will go to your nose or ear. Where it will go?
Cells.
Depends on the need whenever it's needed.
Okay, if the need is nothing, no exercise, body is resting or sleeping or walking, just working, where it will go?
It will go,
to the leg?
it will go to the cells.
Yeah, it is correct. It will go to our body cells, because cells are requiring some energy, and glucose is a source of, it give energy also. Okay, but the question starts from here. How much the body will absorb in one time? Let's say 100 gram is there in the blood, insulin takes away from your blood. How much the body will absorb? How much you think? 100 gram or 50 gram? Or 1 gram? Or 1.5 gram? Or 0.5 gram? How much you think? Anuruddh?
1 gram.
1 gram is told by Asya Sabreen. What a nice answer. And what about Hema? How many grams body will take? Only? Mehak? Mehak, I have told you, I think once. You forgot already. Okay. And Renuka. Okay, Dr. Vandana, you know how many grams, or Anirudh? The answer is the body can take maximum 20 gram in one time. More than 1 gram. Okay. And where the rest will go? 80 gram, it cannot come back to your blood, you become
It will be
diabetic.
converted into glycogen.
It will be converted into a little glycogen, very, very little. Maybe it will be 1 gram, maybe less. Rest, where it will go? Another step. It will convert into
fat.
what? Fat.
Fat.
In the liver.
Fat deposit.
In the liver. Glycogen cannot be converted 100 gram. There is no place in the liver. And it will be converted into fat, and it will start accumulating in the body.
Stored in the gallbladder.
Rupinder, not gallbladder, belly fat. Okay, there are some, gallbladder is another thing, it can happen, but gallbladder cannot be 100 gram. Gallbladder is very small. Logically, you think. So 100 gram is 50, 80 gram is a lot. Belly fat when becomes, people become 100 kg, 80 kg. So that is the reason. It is not the fat in the gallbladder. Gallbladder is releasing, okay, bile, which is breaking down the fats when you eat. Okay, that is a different thing. So mostly the fatty liver is happening. Mostly it will has stored in a belly fat or hip fat. Woman lower part of the body, mostly thigh fat like this, and man belly fat is the most common. So nowadays, every day people are taking so many morning time idli, dosa, chapati, rice, 100 gram, 150 grams. Some part is converted into fat. Lunch time again 2 roti, 3 roti, upma, rice, chapati. Evening time again some snack will be there. Somebody will take some like biscuits or something. So every time people are taking so much of carbohydrate, and some part is converted into fat. If one day also 100 to 100, 200 gram in a month, 3-4 kg increase, isn't it? Now the question is, you tell to your client, okay, from tomorrow, Mr. Ravi or Mr. or Mrs. let's say Rupali, don't take any roti, don't take any poha, don't take any rice. Does the client will agree? What do you think? Yes or no?
No.
No, because everybody will tell you, I want to have some rice, I want to have some chapati because I like it, I know from childhood. So ideally what you have to do, you can give some roti rice also, but in an intelligent way. Here comes the role of the diet plan. Here comes the role of the knowledge. There are certain hormones that are in our body that can burn the fat. Anybody knows? Fast answer. Who knows? What is the name of the hormones? Anirudh, Rupinder, Dr. Vandana, can you name some hormones which are fat burning hormones, which are very important for us? You heard about it? Aisha, Sabreen?
Pectin.
Anmol, leptin is not a, it's a satiety, it is not a fat burning hormone. Rohit, Anmol, you are a dietitian. I think Nivedita is a dietitian, Renuka is a dietitian, Manasa, I think is a dietitian, I think. Muruna,
Sir, leptin.
leptin is not a fat burning hormone, it's giving a satiety. Okay, it is a fullness, it is a different. So no one knows Rupinder, Anirudh, Rohit, Doctor. Okay, I'll tell you, there are many hormones are there in our body that can burn the fat. Some of them are called somatotropin hormone. Some of them are called also, there are growth hormones and glucagon. These are the hormones which can burn the fat. But if the body is not getting proper nutrition, a lot of people will take a lot of carbohydrate. Only rice and sabji or chapati and sabji, no vitamin, no mineral, protein, the hormones will not be working properly. And also every time you see mostly we are eating a lot of carbohydrate. Morning time, idli, dosa in South India, North India, it will be roti, paratha, or in Gujarat, it will be khichdi or poha, all carbs. And lunchtime again, some carbs, roti, rice, chapati, upma, evening time snack, and or night time again, somebody will take roti, upma, rice, night time again, meals. Every time insulin levels are higher. When insulin levels are higher, the fat burning hormones are switched off because insulin is a dominating hormone, very strong hormone. Like USA is a dominating country, it will not let insulin when it's high, the fat burning hormones are switched off. That is the reason a lot of people, even though they are doing exercise, I think Anirudh, you are a fitness coach. There are a lot of things you see people are doing everyday exercise, going to gym and no weight loss and weight come back, losing and coming back. Why? Because if there is a insulin resistance, exercise will not work properly. Gym will be giving you around 20%, 25%, 70% is your diet. Now the question is how to activate these hormones. In order to activate these hormones, we have to lower down the insulin. Insulin level comes down means fat burning hormones are activated. Okay, and how to bring it down? You cannot stop. We have to, of course, you have to use. You cannot take a lot of carbs. You have to play in the portions, but you have to have a proper combination. Let's say you are taking morning time, let's say oats or some other. With that, you have to add some other nutrients which will lower down the insulin level. There are many nutrients that they will lower down the insulin level. That also you will learn. Lunch also you take rice. Also you don't take rice. You take chapati, but with a proper combination that will lower down the insulin level. Night time also. Of course, night time it is better to take less carbs, but in such a way that you are lowering down the insulin level. When the insulin level comes down, the fat burning hormones are activated. So in this way, how your clients will burn fat? Like you can see 24 kg loss in 90 days, PCOD reversed. Okay, you can see this woman was having diabetes type 2 and cholesterol and thyroid. Her diabetes, her sugar level was around more than around 300, and also HbA1c was 15, and she was taking insulin. She was taking around 18 units injection. Metformin stopped working, but she was eating, diet was very bad, and she wasn't able to recover. See how she was having overweight up to 87.7, 87.5 kg. Now, after taking my diet plan, she not only reversed the diabetes, insulin intake came down. How? Because I will tell you there is a insulin resistance is there. You have to know about it, how to overcome the insulin resistance. Then, and she stopped taking initially 6 units she was taking. After 1 month, after 3-4 months, she was not taking any diabetic medication, and she completely recovered diabetes. Now she is looking 10 years younger, no cholesterol, no diabetes. So in this way, you also learn how to reverse diabetes, and in a scientific manner. Not only eating less food. Eating less food is not allowed. You have to eat a balanced food and with a proper, sort of your insulin level is coming down. Now, everybody knows that. What do you think? There is a carbohydrate addiction. Is there? Yes or no? Is there any carbs addiction?
Yes.
Yes. there is a carb addiction is there. The addiction is very strong because it is affecting our, there is a pleasure center in your brain called nucleus accumbens. And the addiction is such that when people take carbohydrate, they become happy. Lot of, a lot of idli, lot of dosa will release dopamine. The brain will give a, reward. Okay, because the receptors are there in your brain, dopamine receptors, which will give you happy hormone called dopamine. And also GABA and that is gamma aminobutyric acid and serotonin. All these things makes a person happy. Same thing, slowly your need will be more. Same thing if a person is having, tobacco, smoking, the body demands more because body is getting pleasure. Same part of the brain is affected, that is nucleus accumbens. Same thing, alcohol or drugs. So sugar addiction is very, very strong, remember. And people can not stop it eating. Okay, and it increases more and more because dopamine receptors demands more. But there is a way how to overcome the craving. There are many nutrients you can add like vitamin B, potassium, magnesium, chromium, zinc, omega-3. Then your craving will be much lesser. That also you will learn. And everybody knows what is cyanide. Yes, cyanide is a chemical. When people take, you will die immediately. Why? It is it is blocking the mitochondria. Mitochondria damages and people die immediately. But if you take a lot of carbs also, it can damage the mitochondria. A lot of carbohydrate is a slow poisoning. Okay, slowly your enzymes like AMP kinase in the mitochondria is destroyed. Mitochondria is the energy house, remember. And after some time, your body will have diabetes, fatty liver. Like, whenever people take alcohol, alcohol is made up of from where? Let's say vodka, or let's say this beer. They are all made up of carbs. That is, when grain is fermented by the yeast, you are getting alcohol. And when you're taking a lot of carbohydrate intake inside your body, the body will ferment in the liver, you will get same acetylcholine. Means your body will be poisoned if you take a lot of carbohydrates. So and it is giving rise to even children are getting fatty liver and diabetes nowadays. There is another thing which is very important to know, what insulin resistance. It's a little bit, I will not tell complicated, but a lot of people are confused about insulin resistance. Anyone knows what is the meaning of insulin resistance? So many dietitians are there.
Yeah, body stops to take note of the insulin and stops entering of glucose in the cell.
Body cannot write any note, you may remember. So the clarity has to be there. In insulin resistance, insulin level go high or go down. What do you think, Mrunal? Mrunal is sleeping. Nivedita is sleeping. Manasa is sleeping.
So insulin resistant is when cells don't respond.
So in insulin
well
resistance, what happens? So insulin level goes down or goes up?
Initially it goes up.
It will go.
1%. Nivedita, tell. Goes up or goes down?
Insulin resistance is actually they don't respond, sir.
Wait. I am telling about insulin level. Will go high or go down?
It would go up initially.
Wait. I am not asking you. Let's Nivedita. Let's the girl tells. Nivedita, what do you think? It will go high or go down? No idea? Confused? Okay, then the boy answers. Mrunal, who was answering? Anirudh. What happens? Insulin level will go high or go down?
It will go up initially, but after some upwards.
Okay, so Vandana, Dr. Vandana, what do you think? Do you agree? One person is telling going down, one person is telling going up. Generally, what will happen in insulin level when you have insulin resistance? It will go high or go down? Manasa, Anmol, dietitian Anmol, your MSc, tell us. You should know it. You are a very good dietitian. Ayesha, Sabrine, what do you think? Okay, so there is a confusion.
Yeah, insulin will go up, sir.
It is told by Anmol, yes? Okay, Anmol.
Yeah.
But why it will go up? The question is this. Okay, generally what happens when you are taking a lot of carbohydrate? And are you sure only carbohydrate can increase insulin level? What do you think, Anmol? What are the other food that can increase insulin level?
Yes, carbohydrates and high fat foods also. High fat content foods.
Is it not
They
correct?
can increase.
Actually, carbohydrate and protein. If you take a lot of protein shakes out of all of the LEVs of insulin resistance. Lot of protein shakes you take. Lot of people from Herbalife or Amway Life will come to me to study. Why? Because they see after 1 month the weight is first month 5 kg, next month 2 kg, third month 1 kg. And they will fool the people, buy more supplement, people will spend 10,000 and 20,000 and run away. There is a reason a lot of protein shakes will also increase the insulin level. Remember, ideally what happens when you are taking, let's say morning time you are taking, let's say take an example, morning time one person, let's say will take one bowl of idli, dosa or chapati, 100 to 100 gram. Lunch time again people will take some carbohydrate, again 100 gram, 150 gram. Evening time again 100 gram of some snack. Night time 150 gram of rice chapati. Every day people are taking 600, 500 grams of glucose every day. How much the body will take? One time 20 gram in a day, 100 gram. Maximum body will take 100, 120 gram. Rest is going to your liver only. Where the rest of carbs will go to your liver and turn into fat. That is the reason so many people are having fatty liver, 65% to 70%. And that is the reason belly fat is coming. Okay, belly fat in women, hip fat, thigh fat, all these things. And it is giving rise to visceral fats. Organs become fatty like liver, fatty liver, the heart, other organs, and it is giving rise to cholesterol, where the fat will go, and strokes, and also other diseases like diabetes, hypertension, non-alcoholic fatty liver. It doesn't mean that fatty liver should happen. Uric acid will go high also, because not only people take meat will increase the uric acid, glucose can also, end product of glucose is uric acid. And also cancer. Why cancer? Because my research work is on cancer diets. In cancer cells, what happens? Just for your knowledge, cancer cells will eat only sugar, glucose. It's called Warburg effect. It doesn't require oxygen. It is growing very fast, and it will. Professor Warburg got Nobel Prize for it, and also it doesn't have any mitochondria. So cancer cells are growing 200 times faster. They live on only glucose. So one of the things in the cancer, we stop the glucose intake. And that is one of the reasons India is having so many high rate of cancer cells. Cancers are there. Remember, one of the reason is this. And that is the reason other diseases can happen like diabetes, hypertension. Why? Because insulin level goes high. It keeps on going high. And we never check insulin. We are checking directly blood sugar. Why? Because if you check insulin, imagine everybody know about the insulin, then nobody will get diabetic. And diabetic can be stopped, and how the pharma company will earn? They have to also earn money, because pharma market for diabetes is around $380 billion, very big amount of money. Total pharma market is around $2 trillion. Indian GDP is 3 trillion. You can understand how much the company earns. So insulin test is not popular. Nobody knows about it. It is done in some places in USA. It is called HOMA HR test. Nobody knows about it. Even doctor doesn't know. Directly sugar increase and take medication for a whole life. That is what diabetic company wants to do, but we will learn how to see that there are many reasons when insulin levels go high, because people take a lot of carbohydrate, 5 times more insulin level, because so much carbohydrates has been taken in Indian food. Okay, but what happens when carbohydrate insulin level goes high? Our body is having cells. Cells are what? Cells are there in our body. Everybody has studied in school. Cells are there. In cell, you have got some channels called glucose channels. It opens up by insulin. Insulin is called insulin is the carrier, or it is a key. Insulin comes and opens and unlocks the insulin receptor, and this glucose channels or protein channels will open, and sugar comes inside normally. Okay, but what happens when insulin level goes high and high and high? Of lot of idli, dosa, chapati, rice, protein shakes, or people are taking a lot of food with high carbohydrate intake, insulin level goes high. And what happens when insulin level goes high? Our body cells, receptors will not respond. So insulin is bringing the nutrients, it is blocked. It cannot go inside. That is the reason what happens. Sugar level increases. Like somebody is knocking your door, you are listening music with your earphone. You didn't listen, then you are not opening the door. Same thing, when insulin levels are higher, the body cell receptor will not respond to insulin. And what will happen? Sugar is high, that is called diabetes. Okay, but everybody is understood what is diabetes, how it happens, diabetes type 2. But sometimes what happens, diabetes doesn't happen in one day, it takes very long time. Initially, insulin resistance happens. What are the symptoms? Fatigueness, because body is not getting full nutrients. It is blocked. And also you are getting what? Sugar craving. You have seen a lot of people, are, telling I get so sugar craving in the evening time. I cannot stop. I take a lot of, sometimes junk food. I take burger, or I go for a sweet craving happens. Night time, people are ordering pizza or eating a lot of sweets. That is what the sugar craving is. Okay, because body is a cellular level, body is not getting sufficient fuel or glucose, and it is giving rise to diabetes. At the same time, what happens? Body will not get other nutrients also. There are glucose channels or protein channels. Everything is blocked. No vitamin, no protein, no fatty acids. Everything is not coming inside the body cells. Potassium is not coming. So what will happen? The hormonal imbalance starts. Hormones are made up of vitamin, minerals, protein. Even though you eat food, you get hungry again. And simultaneously, you are getting diseases like low potassium. Potassium is not coming. Potassium very important for your body's cardiovascular muscles, and also constipation can happen, cramp can happen. Sometimes muscle cramp in the knee, in the leg. Kidney issues can happen, uric acid can happen, and also skin issues. All these things are starting, and what you are getting here, insulin resistance and hormonal imbalance. All diseases like PCOD, acne, facial hair, infertility, thyroid issues, cholesterol issues, weight is stuck. Everything is, people are not getting any this insulin resistance. If you do exercise also, you don't lose your weight. In pregnant women, you see a lot of people are having thyroid is mostly in the pregnant after pregnancy. Why it happens? Any idea? Do you know, Nivedita, why it happens? Thyroid happens mostly after pregnancy. Why? Farah, do you know about it? No? Anyone? Murna, this is Anuruddha, do you know why thyroid hypothyroidism happens in women 80% higher after pregnancy? Any idea? No? Nivedita, can you tell? Don't know? Rupinder? Why it happens after
Sir,
pregnancy?
hormonal imbalances.
Hormonal imbalance at 6th standard class will tell. I will tell very good. You are a dietitian. This answer is not acceptable. Hormonal imbalance. But how? Mechanism. What is a mechanism? Hormonal imbalance is a generic word, It cannot be, you have to explain it. Any idea? No idea. Okay.
Imbalance of
repeat,
proteins, carbon.
Repeat. Why pregnant women have a high level of thyroid? Immediately starts. No? Rohit? Aisha? Okay. I see nobody knows properly. Okay.
Because of high level of fat, so
Fat.
they will T3 and T4 hormones are
Who is
properly.
Rohit, you are telling?
Anirudh.
I am very not happy with the answer. What happens generally, I'll mute everyone and explain. Look, in pregnancy, estrogen level increases. When estrogen level increases, estrogen is a female hormone, and it will increase the T cells. T cells are immune cells, like fighters, which will fight against anything attacking to our body. T cell increases, and T cell will increase so high, it will start attacking our own body cells. Autoimmune thyroid means it will attack the thyroid gland also. That is the reason in pregnancy, pregnant women are getting a lot of thyroid. That is autoimmune thyroid. And the treatment is autoimmune diet plan. You will learn how to create it. Okay, so in this way, all diseases are happening due to the insulin resistance. Now, insulin resistance is clear, and also other things can happen, like uric acid can increase. A lot of people think, I am taking meat, I will increase uric acid. No, I have seen a lot of people from Gujarat, Rajasthan, they don't touch meat also. Pure veg. They are also having high uric acid. Because why? Because end product of glucose is uric acid, like here. ATP is adenosine triphosphate. I hope some know, the glucose is converted into ATP energy. And ATP is broken, it's converted into ATP adenosine diphosphate, and energy you are giving it, and ultimately uric acid. So more carbs, more uric acid. And what will happen in future? It can block the endothelial nitric oxide synthase. It's a enzyme which will lower down the blood BP level. And when high uric acid can block this enos, and high blood pressure happens. That is one of the reasons when people are having diabetic, people can have high blood pressure. Very, very, you see a lot of people of diabetic are having high blood pressure. Okay, in this way, you will see that everything is linked. How you are eating food, you are getting diabetes and BP, then hormonal imbalance, everything. So you can understand how women are getting now, if you take a lot of carbohydrate, what we are having, all diseases. In acne, why PCOD has acne and facial hair? Don't tell hormonal imbalance. I want a mechanism.
Because of increase of testosterone.
Yes. But how it increases? Why it will increase? Aisha, do you know, Rupinder? Why it increases? What is the reason one woman is having, one woman is not having? The answer lies in the fact that when the insulin level goes high, why insulin level will go high? Because lots of carbohydrate. Morning time, idli, dosa, rice, chapati, sandwich. Lunch time again, evening time again, roti, rice, chapati, or protein shakes, or lot of intake of momos, everything. It will increase the insulin level actually. When insulin level goes high, slowly, you are getting, there is a pituitary gland will release more LH hormone. Okay, the luteinizing hormone, it will in turn increase the androgen or testosterone. Our TECA cells over releases testosterone. Okay, but that is the reason people are getting in PCOS, PCOD symptoms are getting initially facial hair. Difference between PCOS and PCOD, anybody knows? Anirudh, you know? What is the difference, basic difference between PCOS and PCOD?
Syndrome and disorder.
I know, but what is the difference? Why PCOS sometimes, what PCOD? What is the difference, basic difference? No idea? Aisha, Murunal, Farah, you are a dietitian. Hema, banker, Rohit, also dietitian soon. Okay, then Nivedita, dietitian. Why? What is the difference between PCOS, PCOD? Dr. Vandana, any idea? Don't sleep, please. What is the difference? The difference is this: PCOS is polycystic ovary symptoms. Sometimes you will see that there is in the reports clean. Reports doesn't have anything. Even you do all tests, you will see everything is fine. But you have got symptoms like acne, facial hair, pigmentations, hair loss, some weight gain, all these things are symptoms. These are called PCOS. When it is, you can see the cysts in the report, then it is PCOD diagnosed. It is called polycystic ovary disease. Okay. And this is happening why? Because of the high insulin level goes high, and that is the reason androgen will increase. Androgen is little in a woman, but when insulin level goes high, it will start increasing. That is, then what will happen? Slowly, you are getting acne, also pigmentation, and pimples, and also irregular periods. And slowly, you are getting, women will get this cyst formation. And after that, what will happen? Slowly, it will start creating problems. Periods are less. Periods are not coming, flow is less, and this cyst may rupture sometime, and infertility can happen. And you have to do operation to take away the uterus, and it becomes very painful. And it can give other diseases like endometriosis, like fibroid. We will not discuss today. It is a little bit of complex. That also you will learn how to create fibroid diet. A lot of women are having fibroid, mostly vegetarian women. If PCOD is not treated, then you can get endometriosis. Means there are some this endometrial tissue growth happens, and fertility will not be there, painful. Fibroid means there are some tumor can happen. It can be a size of peanut to a one big basketball also. All these things are very dangerous. Okay, so PCOS, PCOD not treated, you can get diabetes also because of the insulin resistance. How to overcome PCOS, PCOD, that also we learn. There is another mechanism is there is another hormone is called sex hormone binding globulin. It is released from your liver, and when insulin level goes high, this SHBG will also decrease. Means it will increase the testosterone. Okay, so I will not go so much deep today because we have got separate lectures for PCOS, PCOD. There are 4 lectures are there, and you will learn how to create a diet plans. And also there is another PCOD is there when women are thin, still PCOD. Do you know what is the name of this PCOD? Rupinder, Anurudh, Dr. Vandana. There is another form of PCOD where the girls are thin. They are like athletes, running, but still PCOD. Why?
Improper diet and lifestyle.
What is the name of that new form of PCOS, which is found in lean women? You don't know? Nivedita, Mehak, Vandana, Dr. Vandana, Anurudh. This is called lean PCOS. What happens here? People are getting menstruational issues are there, acne is there, and the girl doesn't really, she will tell you, I'm not fat, how I can become PCOS. So that is what it's actually, it is a PCOS, lean PCOS. And it is also a lot of women are having nowadays. A lot of things are there, like, the anxiety is there, infertility is there. And also sometimes there are CRP, that is C-reactive protein is high. What is C-reactive protein? It's an inflammatory, inflammation happens. ECR, erythrocyte sedimentary rate. You learn how to diagnose this also, because a lot of people are puzzled, my weight is less, how I have got PCOS. Same thing, there are many cases of thyroids are there. Okay, in hypothyroidism, what happens? Everybody knows what is hypothyroidism. There is a gland, thyroid gland in our neck. Okay, by the way, PCOD can be reversed. All my clients, all my students' clients are also reversing PCOD. The cysts are, after taking a diet plan, they are a special diet to lower down the insulin level. You can see the 7.5 is decreasing to 6.2, that is cyst, and people are getting fertility issue is also solved, and also periods are also back. So in this way, PCOD can be reversed completely. This woman lost 85 kg, lost 6, he's from Punjab, vegetarian, 6 kg lost, and this is for cyst reduced. Okay, same thing with the thyroid. A lot of people think, you know, I'm having thyroid. Okay, fine, I will take Tylenol medicine, but Tylenol medicine is not a full recovery. Why? Even though if you take medication of thyroid, Tylenol or thyroxine or L-troxin, all the symptoms are persisting. Like weight gain will be there, okay, and fat, weight, then also fatigueness, hair loss, infertility, miscarriages. I have seen one of my today. I had many consultations with thyroid. One woman have got 6 miscarriages because thyroid issue, and her weight is now 120. She's taking 200 mcg. Thyroid, she started with 25, then 50, then 75, 100, keeps on increasing. Why? And sudden that can happen after thyroid. Diabetes is very common because Tylenol, when you take, it is not a treatment. It is like just to give you a support. Like when somebody breaks the leg, okay, you are giving a stick to work. If the leg is not cured, the person will take another stick. Same thing, the dosage increases and thyroid will be persisting. So in order to overcome the thyroid, you have to make sure that your gland, thyroid gland is synthesizing hormone properly. It is synthesizing T4, which is converted into T3 in the liver, and also calcitonin. The T4 is a hormone which is responsible for the person's metabolism. What is metabolism? Is the conversion of food into energy. So when you're eating food in hypothyroidism, the food is converted not into energy, into fat. People are getting slow, very, very low, very fatigueness. Okay, weight is gaining. You try any diet plan, it will not work. There is a special diet plan only, that is thyroid, hormonal diet plans, balanced diet plan, it will work. Otherwise, you can do any exercise day and night, break your head, you will nothing will going to happen. So that is the reason I have seen people almost starving, taking one fruits at night and one chapati a day. Still weight is 85, 89. Height is 5.3 in hypothyroidism. So I'll show you many case studies. Okay, you can see this woman was having mostly my patients of thyroid are vegetarians. Okay, around 90%. This woman from Gujarat, Sangvi, Mrs. Sangvi, her THS level was 23, very high. Normally it should be less than 5.5. And it came down to 9.3, then to 5 in few months, 3-4 months. What is the meaning of THS? Thyroid stimulating hormone. So T4 is less, it will give signal to hypothalamus that, hello, I have got less T4. Then body will release TRH, thyroid releasing hormone, then it will release pituitary gland, TSH. TSH is a thyroid stimulating hormone. The range should be up to 1.8 to 3 normally. If it is more than 3 or 5, it is already hypothyroidism which is going. And what happens? It is like, you know, central government, central organ, pituitary gland will tell the thyroid gland, hello, prepare more. So that is the reason THS level increases the indicator. And this woman, her THS level was increased, hypothyroidism, it came down. Same thing you can see, thyroid can be reversed. This woman was having Mrs. Kanchan, 94 kg came down to 14 kg in 2 months. Now she is around 68 kg. And also she reversed thyroid, her doses were 125 mcg, it came down to 75. Now she's not taking any medication. In 6 months, she reversed thyroid. Same thing, this woman was having also 75 mcg hypothyroid, this Tylenol, it reduced to 3.287 THS, and thyroid can be reversed. You will also learn how to reverse thyroid, because only taking medication will not help you, because thyroid is affecting whole body, duodenum, constipation. Thyroid patient, the pancreas issue, they can have also diabetes. Thyroid people can also have a liver issue, fatty liver, and also placenta, means this infertility and also miscarriages, follicle. So in this way, thyroid only medication will not help you. You have to take a diet plan, then you can reverse thyroid also. So in this way, you will learn how to reverse thyroid, overcome the insulin resistance. You have to make a diet in such a way that insulin level is coming down, so body is absorbing nutrients, and thyroid can be reversed. Okay, there is another thing I want to discuss about insulin index. We discussed insulin resistance. Yes, I think Anirudh, somebody told, Nivedita told, okay. But there is a glycemic index we discussed. how to reverse PCOD, thyroid, fatty liver also, you know how to reverse cholesterol, because cholesterol is coming from the carbs, remember. What is the meaning of insulin index? Anyone knows what is insulin index? Anmol, you know? What is the meaning of insulin index? Anurudh, any idea? Nivedita, dietitian, Nivedita, Aisha, you are also dietitian, I think, yes? Yeah. Hema, welcome back, Hema. Oh, Hema, you disappeared again, came back. Very good. What is the meaning of insulin index? Any idea? Rupinder, Farah? No idea?
Sir,
Insulin index is which actually represents how it elevates the concentration of insulin in the blood.
But insulin index of tell me one thing. For example, egg. Egg white is good or egg egg yolk is good. What is good for us? Yeah, Rohit, don't shout. What is good for us, Nivedita? Egg yolk or egg white?
sir, egg white.
Very good answer. What a great
Egg
answer.
white, sir.
Egg white, very good answer. Anmol, you also think egg white is good, yes? Egg
No, sir,
yolk
both
is
both
good.
are good, sir. Both are good. Depends on the
Wait, who is telling? Anirudh is telling both are good. Okay. Now the question is, somebody is telling egg white is good, somebody is telling both are good. That question is, what is the meaning of HDL, high density lipoprotein? It is good or bad? HDL,
HDL.
LDL is
Good,
good.
good.
What is bad? LDL is good or HDL is
HDL
bad?
is good. HDL is
HDL
good.
is good.
LDL is bad.
HDL is bad. So
HDL.
our egg yolk has got HDL. So don't worry. In 1920, there was an article, okay, egg yolk has fat. People are still thinking egg yolk is a healthy fat. Egg yolk contains protein also. Egg yolk contains vitamin D also, vitamin B12, and it contains folate. Is very useful for us. And that is the reason, Nivedita and Rohit, don't worry to take egg yolk. It will not increase the cholesterol. It will help to lower down. It's a HDL helps us to lower down the, remember, LDL. LDL you are getting from other foods, other fats, remember. And carbs are converted into LDL and HDL in the liver. Now the question is, which is having high level of insulin index, Nivedita? Egg yolk or egg white? What do you think? It's a kind of a,
Egg white.
Egg white have high insulin index. Why not egg yolk? What do you think, Hema?
Egg yolk. Egg yolk.
Who told egg yolk? Nivedita, yes?
I know.
Anurudh. Yeah, Anurudh. What do you think? Egg yolk has high insulin index or egg white?
Sir, egg yolk will have more because it has higher fat content.
Higher fat has higher insulin. Okay, so there is a confusion. The answer is number one insulin spike. Who will do? Number one insulin spike will be done by carbohydrate. Number two is not fat. Number two in the champion is our protein. Remember, protein can also create insulin spike. There is a lot of protein. If you take your weight may stuck. Then number three is the fat. Fat are friends. Remember, nobody will become fat by eating fat. If you ask a person every day 100 kg or 90 kg, how much fat he takes? Is he taking one bowl of butter? No. He's not taking oil, will not increase the weight. Or the oil is taking 1 spoon, 2 spoon, 3 spoon. People doesn't take. So fat cannot increase. The weight is increased by mostly carbs, and sometimes you take excess of protein also can increase the weight. That is the reason. Now the question is, egg white has having very high insulin index. I think Nivedita told or somebody told, yes, because it's a pure protein. If you imagine taking 5 egg white at night time, what will happen? The insulin level goes high. It is not good for us. As you discussed, insulin level goes high, fat burning hormones are deactivated. Same thing, egg yolk is having low insulin index. It's a healthy fat. So when you take both together, it will come down. Like egg white is having around 55% of insulin index, and egg yolk is 15. When you take together, it will be 12%. So there is a reason full egg you have to take. Don't worry. Not a question. There is another thing. A lot of people likes to have snacks, but our snacks are good for us. Everybody will tell now healthy snacks are good, unhealthy snacks are bad, isn't it? Isn't it, Nivedita? Snack are taking snack number one in the mid morning, snack number 2 in the evening time, snack number 3 after eating food. Also, you have to eat something to not get hungry. So snacks are good for us, yes, or bad for us?
Good, sir.
Very good for us. Very good for us. Yes. Nivedita, do you agree? No answer.
Depends. Yes.
Depends on
Uh,
what kind of snack. Yes, good snacks are good.
Yeah,
Bad
depends.
snacks are- This answer
Yeah,
I
yeah.
was expecting, which is not true. For that to understand snacks are good or not, Hema, what do you think? You are a banker. You have to eat a lot of food, so your mind works very well. Snacks are good for us or bad for us? Okay. So let me give you an example. Then you will understand. There is a scientist called Guyton. Most of the people have heard about it. Most of the people doesn't heard about it. He received a Nobel Prize. Nobel Prize is the highest authority. And what does he tells? Listen carefully. All aspects of fat metabolism are greatly enhanced. Enhanced means increased in the absence of insulin. What does it mean? When insulin level is high, fat burning will happen, yes or no? Anmol Joy, you are able to hear?
Yes, sir.
When
Yes, sir.
insulin,
Yes, sir.
what does it
Yes,
mean?
sir.
When all aspects of fat metabolism are greatly enhanced in the absence of insulin. When insulin level is high, fat burning will happen, yes or not happen?
No, sir.
Who told no? Rohit told or Anuruddh told. Okay, Nivedita, what is your analysis? When insulin levels are higher, fat burning will happen, yes or no?
Yes, sir.
Fat burning will happen when insulin levels are high, yes? Rupinder, Anuruddh, Aisha, Farah, Mansa, Dr. Vandana, where you disappeared? You are answering so nicely. Manasa didn't answer anything. Manasa, are you sleeping? Okay, Aditi also not answering anything. Are you sleeping? Or you are so shy? Okay, don't get shy. You have to speak. Speaking is very easy and nice, isn't it? So why, when insulin levels are higher, fat burning will happen, yes or no? Finally, I'm asking. Anmol.
Yes, sir.
Okay, insulin levels are higher, fat burning will happen. Yes? The answer is no.
Yes, sir.
What is written here? All aspects of fat metabolism are greatly enhanced in the absence of insulin. When insulin levels are higher, no fat burning will happen. In the beginning, I told when insulin levels are higher, fat burning hormones are deactivated. So if you take a lot of snacks, a lot of dietitians likes to give snacks. Snack number 1, because you don't get hungry. Snack number 2, sorry, you don't get hungry. Unfortunately, you will get again hungry. Snack number 5. So what happens when you're taking so many snacks? Every time you are increasing insulin, like in the presence of even a tiny little bit of insulin, all fat burning hormones are shut down. What does it mean? If you take healthy snacks also, it may shut down the fat burning. And remember, more snacks, you will get more hungry. Because when you are increasing insulin level, it will come down very fast. So first of all, snacks, irrespective of healthy snacks or unhealthy snacks, will increase insulin level. And when insulin is a so strong hormone, a little bit of insulin spike can also stop the fat burning. So that is the reason sometimes you see people are taking small portion 10 times. Initially they lose weight, after some time weight is stuck, not coming down. And the dietitian will tell you, you are not losing weight, but your inches are losing. She doesn't know what is inches. Still they will tell. This is what's happening. So nowadays you are not giving 5 meals or 6 meals. You are giving 3 meals, sometimes 2 meals also. But the question is, the client will tell you, hello, I will get hungry. What I will eat after breakfast, I get very hungry. Up to lunch, I cannot, I cannot persist. No, it is not like that. You can create a diet plan in such a way in the breakfast only with a lot of nutrients, balance where the insulin level comes down, the person will not get hungry. Same day, lunch to dinner, they will not get hungry. From dinner to morning, they will not get hungry. That is a technique you will learn, that insulin spike is to come down. So nowadays, in the latest nutrition and dietetics, you don't give a lot of snacks. That is also a new thing. In India, a lot of people doesn't know we are using the 20 years old snacking diet. It's very old. So there is a reason 97% of the diet plan phase. In this course, you learn a lot of new things which are latest, which are not in the books also, remember. Now everybody knows there is a vitamin which is the vegetarian people are deficiency in which vitamin is deficiency in vegetarian people? Dr. Vandana, you know?
B
B
complex, B12.
B12 also, and also there is another vitamin we are forgetting, that is vitamin D. Vitamin D is also very less because vitamin D foods are mostly found in non-veg item. Now, why the vitamin D deficiency can increase weight. Why? It has been seen most of the overweight people are pure veg. Most, what I see in my practice also. Vitamin D deficiency can increase weight. Why? Any idea? So, no, Dr. Vandana Gohil. Why vitamin D deficiency can increase weight? Nivedita? No idea. The answer is anybody knows what is the no, Anmol, you know? Okay. So what is the hormone that is a stress hormone?
Cortisol.
Stress hormone.
Cortisol.
Yes. So it has been seen that when people are having low level of vitamin D deficiency can increase cortisol, and cortisol is a fat gaining hormone, increases the weight. That is one of the reasons when people are having vitamin D deficiency, a lot of vegetarian people have it, 99.9%. They will have cortisol level goes high, it gives rise to cortisol is a fat gaining hormone. Remember, it will stop the fat burning, to switch over the fat burning hormone. And also what happens, there is another thing happens called gluconeogenesis. What is gluconeogenesis? Anurudh, you know? Gluconeogenesis. Nivedita, Munal, Aditi, anybody knows? Anmol, dietitian Anmol, what is the meaning of gluconeogenesis? No idea?
It is a metabolic pathway that results in the generation of glucose.
Generation of glucose from where? Nivedita, from where?
From non-carbohydrate substance.
For example, protein can also you can synthesize glucose. Even fat can also synthesize glucose. It has been seen that when there is a vitamin D deficiency, it can increase gluconeogenesis, means the protein of the body can convert into glucose. That is one of the reasons vegetarian population have got high level of diabetes. Mostly diabetic people I see mostly in Gujarat, every family will have someone, or Rajasthan, pure veg people, or Jain diets. Okay, in South India also pure veg people will get a lot of vegetarian population will have diabetes. Okay, so in this way you learn, if you have to create a diet plan, in a diet plan you don't add any vitamin D and there is a vegetarian population, what will happen? The weight will not come back, it will be stuck. So you have to add them, and naturally there are some foods of plant protein, plant foods are also there which contain vitamin D. Okay, so in this way you learn a lot of new things, and the knowledge which will help you to be ahead of your own fellow dietitians, because you will learn in-depth knowledge of the international standards, and a lot of things you will learn which is not there in your books also, MSc, BSc, and also in doctors, IT professors also studying, because studying is it doesn't stop. Okay, and for example, a lot of people think, is chicken is a best source of protein? Nivedita, what do you think? Fast answer. Chicken is the best source of protein. Munal, yes?
Yes, sir.
Yes, chicken is a very good source of protein.
Yes.
Rightly. Unfortunately, if you take everyday chicken, you are going to create problem for the patient. Why? You will answer now. I will answer now some new things you will learn. After that, you will be cautious of taking the chicken. Because chickens are mostly you are getting from where? From farmhouses. In farmhouses, the chickens are kept in very unhealthy. In 10,000s of chicken will be there. And the owner of the farmhouse has taken a loan from bank. He has to give as soon as possible, less percentage. So what he will do? He will give chicken the food which are containing growth factors. So chicken will grow in 1 month. From chick to chicken in 1 month, 65% growth is happening. So chickens are grown in such a way unhealthy environment with the growth factors. These are hormones. So naturally chicken will grow in 3-4 months. Here you are growing in 1 month. That is what in the chicken meat you are getting growth factors. More genetically modified, these growth factors are given. And also chickens are fed with what? Omega-6 to make it bigger, bulky. That is the reason they are given a lot of food which are rich in omega-6, which can create inflammation in your body. So if you take a lot of chicken, you are getting hormones as a bonus gift, as antibiotics and pesticides. So you will know chicken will take, in many cases, you will see it will increase cholesterol, and in women also, if you take every day, you can get hormonal disorder. So chicken is not a good source of protein. Okay, so if you take everyday chicken, then you are having problems. And it is, you can take chicken, it's not that you stop taking, but not every day. Once or twice in a week, in a daytime, nighttime, chicken will increase the weight. The hormones are there, it will retain water. You will see, tell to a client taking chicken at night time, next day you will see what will happen. There is a reason. Only taking protein is not enough. Which protein? Plant protein also has to be included also. Plant protein are having also high quality of protein profiles are there. Okay, protein, chicken is having 3 amino acids, mostly branched amino acids. You don't have the other amino acids. There are 22 amino acids are there, remember. So it is not that only chicken is a good source of protein. There are other sources of protein also there. We have to take and we'll know about it. And also protein requirement has to be met. The absorption happens not only by eating protein. The absorption will not happen. You can say how much protein is. The way protein shakes are so popular. People are wasting 10,000, sorry, 3,000-4,000. Nothing is happening. 16%. Our rest is going to convert into net nitrogen utilization, means fat you can convert. And also like egg also it is 48%. So there is a way how to improve the absorption of protein by adding enzymatic food. It also you will learn. Ideally, it is important not to eat less food. Remember, eating less food is not eating starving will not help to lose weight. You know, you have to have a proper balanced diet so that your body is getting proper carbs, vitamins, minerals, everything you are getting, and deficiencies are not there. That is very important. Okay, that also you will learn. And also your insulin levels should come down. Then only the body will get hormonal balance, vitamin, minerals, protein will get inside, and your body will get fully hormonal balance. And other diseases like you can overcome PCOD, because PCOD is not treated, you will get fibroid. Then also PMS syndromes, the heart diseases or breast cancer, all these things you are getting. And belly fat, all these things are hormonal imbalance. You learn how to overcome, like weight gain, craving, like insomnia, pigmentation, all these things you will learn. Okay, but only learning the this theory part is not enough. As I told you in the beginning, that you have to learn about the this practical also. Practical means what? You might be very good, you can create diet plan very well, but if the practicals are not, you are not sure how to motivate the clients, how to handle the clients, then you will not be able to be successful. So for that purpose, it is very important that you should learn, how to monitor also. Okay, and motivate the client. For example, after 1 month, all my students are getting clients. You can bring your own clients, or you can ask me. We also provide the clients. I will tell you how we are giving the clients. But only you will not be knowing how to create a diet plan. So I will, this group I am taking, so I will send you the template. If you give me the details of the diet plan person, then you can prepare a diet plan and send it to me first. I will check it, or my teachers will check it. Then we'll give it to the client. But giving a diet plan to the client is not enough. The client will not follow. So for that purpose, what you have to do? You have to motivate it. How to motivate them? So you have to create a WhatsApp group where you are there, client is there. You can add me also. Every time in the morning time, client will send a photo of a weight machine. Very easy. How much time it will take? Take a photo and send for in a few seconds. And when you see that after 1 week, people has lost good weight. Next week, the client started, weight is stuck or weight is coming up. What to do? There will be many reasons. You have to ask. Maybe the client is having issues with the, somebody has taken a late dinner, or somebody has taken a lot of popcorns. Ice cream can happen. Ice cream have taken. And the client, if you don't take the follow, the client will blame you that your diet plan is not working. Give me another diet plan, like that. And you have to ask, what time you have taken a dinner. You are having, sometimes people will take antibiotics, sometimes a late dinner stress, all these factors, or sleep is less, all these factors works, or leptin resistance. There is another thing called leptin resistance. So there is a reason. I will teach you how to ask questions, and also 1 month we will have the practical group. Okay, and you will learn how to control the client. Sometimes what happens, they will send a photo of food also. So sometimes what they tell, it may be different, and they forgot to take the diet plan. And after 1 month, you will see the results of weight loss or weight gain, and that becomes your exam. Because the exam happens here like a US standard of study. Means you don't have to write an essay about diet. No, you have to get a case study. Let's say a woman, 25 years of age, height is 5.3, weight is 85 kg, and also having sometimes acne, irregular periods. Let's say PCOD. You have to get a diet plan. It becomes your exam and the results. Okay, and how you will get the clients? First of all, I'm also having a digital marketing team of 25 people. We are doing a lot of activities. Okay, and also we are publishing a lot of content, a lot of video graphics, and also a lot of good education content. People likes and follows us slowly all over the world. And at the same time, we also invest money in Instagram. Okay, Instagram, Facebook, or Google will do a lot of ads. Per week, we spend lakhs of rupees. So what happens? Whenever somebody is writing in the internet, everybody will search in internet, I want to lose weight, I want to gain weight. They will see our ads. They click on our ads, then our call center calls them, and after that they set up a meeting with our dietitians. Or if you want to get a hands-on experience, you can get clients also after 1 month, 1.5 months, and also you can charge also. Why not? Because you're creating a diet plan. So there is a provision is this, you can earn also a little bit, not too much, because the goal is learning. Okay, there is a reason. You can do it in free also, depends on you. So in this way, the learning and earning possibility is also there. So it will help you not only to learn and earn also, you can happen also. Okay, so let us come to the end of the webinar. So I hope a lot of things you have learned new. So we will discuss in the end now how the groups are there, how we can start studying, and when the groups are starting generally. Okay, so the next group is starting is soon. Okay, it will be starting from this one group is starting 30th. Okay, before the first we are starting. Okay, because on second we have got a lecture also, and we'll discuss how to enroll everything. Okay, so if you are not a science background, BA, banker, or you are a BCom, you can start with a basic course. Basic course, you're learning how to create diet plans, weight loss, weight gain. No complications you learn here. Some diet plans you learn, like detox diet, as I told you, you will learn. And mostly you'll be learning about the weight loss, weight gain, value of the food. So if you want to help people in your family, you want to have some knowledge, then this is a very good opportunity that you will be learning about the weight loss and weight gain also you will learn. Okay, and some special diet plan you will learn, like this detox diet you will learn. Some special diets, like you will learn about this intermittent fasting, sports nutrition you will learn. How much time? 3 months. Every day you don't have to come to classes, weekly twice classes, and after you will get an access to learning center. Every day you have to study, and you have to ask questions me every day as I am taking this group. And after that, when you are coming to the classes, you are getting new study material, but self-study, hybrid study. Of course, there is a fee is also there, because in free I cannot. I have to maintain a team which is also working under me, around 50 members. So it cannot be free, but the prices are low. Like if you are able to join this course for only knowledge purpose, okay, then it will be hardly 5,000, something like that, without certification. If you want the certification, then you have to do the full course. Okay, then it will cost around 10,000, because practical will be included. Only for knowledge purpose, practical doesn't need. If you want to know, if you want to learn something, you can easily learn about it. Okay, but if you are able to if you want to become a full-fledged dietitian, that you have to help people, and also you want to learn how to reverse PCOS, PCOD, the diet plans are costing much higher, then you have to learn the advanced course. Advanced course is mostly for doctors, dietitians, or if you are having already in fitness industry, you are working, then advanced course is important. Okay, because you are learning, when a lot of people will come with all the complications. Somebody will come with, they will tell you that, okay, I have got PCOD, I have got diabetes, all these things you will learn to overcome. Okay, so this course is an advanced level course for those who are already dietitians, doctors. For them it is. Okay, and at the same time you have to know that in this course it is around 3 months of course. But if you are a BA, or you are a not science background, you can start with a basic course, then you can learn this. Okay, and of course this course is a little bit expensive, because you are able to learn about the these complications like fatty liver, thyroid, cholesterol, IBS symptoms, uric acids, everything you will learn. Okay, this course generally costs around 48,000. It's very expensive. But there is a special discount is there. If you are taking both the course, basic and advanced, then it will be only 19,000. Okay, means 4 diet plan. Per diet plan you can charge around, let's say, 4,000 like this. Okay, and pay in installment also. Okay, so in this way, but if you want to take both the courses, it will be better for you. It will be too cheap because you will start with basic a little bit. If you are already a dietitian, will not cover up the basic. You will give you some small, around 5% will be there. 95% will be advanced only. No, it will be fully discounted. But if you are already, let's say, a doctor, or you are already working as a dietitian, then sometimes, you don't have to take the courses also. You have to talk with me. I will discuss. We can do a training program, or you can join my team. So that is all individually you have to talk. Okay. So I think I've given you an idea. If you want to start with the basic, and it is 3 months. If you want to have an advanced course, you have to talk with me, and we'll discuss which course will be easy for you. And individually you can discuss about the payment, everything, and also how you can learn and earn. After 1 month, you'll be getting clients, and these clients will be given. You can get yourself, or you can get from my side, and you can charge also. Means 2 clients in a day, 3 clients in a day. It's already you are earning, let's say, around per client 3,000-4,000 easily. Okay, and we are focusing to the places where people can pay. We are focusing in the big cities. All our all are in this way. Okay, so we will discuss individually how you will be able to get the details. Okay, and anyone have any questions? Anyone
Sir,
have any
fees
questions?
I'm not getting. Fees I'm not getting. Can you please write it down and we can see?
You have to talk with me individually. Who is asking? Nivedita asking, or bank? Who is asking me? I have already sent the details on your WhatsApp. Huh?
This side, Rupinder, sir, Rupinder.
Upender. Okay, you want to go? What is your education?
Sir, I'm not from science background. I have done commerce like MBA
Okay, so if you are a commerce background,
and then alternative therapies.
yeah, you have to first take the basic course. Okay, basic course can be taken, and basic course you take, then you can start the advanced course. But what is your goal? What the goal is? What you want to work as a dietitian, or you want to just learn for yourself?
Sir, I want to be a clinical nutritionist or nutritionist like in my family members,
Okay.
or because I'm treating worldwide. I'm just giving the therapies like aromatherapy, color therapy, acupressure, lot of the therapies. So combination is I think it will go good.
Yeah, so what
In
we
that
will do, we will find out a best package for you. It is individually we will discuss. We have to take the basic, and after some time you have to take the advanced also. Okay, and talk with me after
Okay,
you finish
thank you,
the
sir.
lecture. I'll discuss because your need is you want to help your family. So that is the reason you will have. If you want the certification, it is another. If you have to do both the courses, then you will get a certification. If the certification is not needed, then it will be much cheaper also. We'll talk after we finish. Okay, so about the how to start the courses, how to join, we'll discuss separately. And for that purpose, what I will tell you, call me, then we'll discuss, because there is an option is there for learning, and earning is also there. You can take both the course also, or you can take basic course and advanced course. So we'll discuss in this way. Okay, so I'm here with the WhatsApp because the payment, all this issue is individual. Okay, generally it starts from 5,000 to it ends up to 19,000. So what kind of courses you want, we have to discuss individually. Okay, so I hope everybody has enjoyed the webinar. And I'll be very happy to that you have joined. A lot of people have taken part. And I'll be if you have any questions, talk with me. Or if you are already a dietitian, if you have good knowledge, so there is an option that you can join my team also. You can join the training program first, and after that you can join the team and earn also. Because my dietitians are earning around every day 1 or 2 client, 3 client. You'll get per client, you can charge up to 4,000. In a day, 10,000 means how much in a week? Let's say 20, 30, 40,000 in a month, easily 1 lakh you can earn. So that is the reason you have to talk with me. How to ideally a training program is there, then you can join my team. Like Farah is a dietitian, like Nivedita is a dietitian, you have to talk with me. Okay, so I hope that you have enjoyed the webinar, and don't hesitate to ask me questions. Directly call me on WhatsApp, Rupinder. I'll be calling you now, so that we can discuss about how you are able to join it. Okay. Okay, then it was very nice talking to you. Anirudh, also talk with me. We can discuss how this course will help you, and or you can. You are a fitness coach. So what is your education, or you are a BE? I think engineer. Yes, Anirudh. Okay. Yeah.
Yes, I am a BE, but I am
BE.
into fitness. I would like to
Fitness.
join this course. I will discuss
So
with you.
talk with me how you will be able to get the best way of support and certification. If you want internal certification, we'll discuss. Okay. Okay, then. So good night to everyone. And I hope the knowledge what you get in this 1.5 hour was useful, and you learned a lot of new things. Eye opener will be there for you also. Okay. So directly talk with me on WhatsApp. So to find out how you can join, so that you are able to know that this course what kind of course you will join. It depends on your budget also. Okay. We'll discuss. So it will be adapted for you. Okay. Thank you, and have a nice evening. Okay. Thank you. Good night.